Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program.
Hi, Miss Smith.
Hi.
How do you feel?
Very good, thank you.
To assist with ambulation using a gait belt, prepare the patient for the procedure and lower the side rail nearest to you. With the bed in its lowest position, raise the head of the bed or help the patient into a high Fowler's position. If the patient is in a chair, have her sit up with her feet flat on the floor. Help her sit on the side of the bed for a few moments, dangling her legs and taking a few deep breaths. While she does this, apply a gait belt. Make sure that the belt is under the breasts when using with a female patient.
Okay.
Help her put on non-skid slippers or socks and non-skid shoes.
You feeling dizzy?
Ask if she feels dizzy or lightheaded. If she does, check her blood pressure. If needed, make additional arrangements. For instance, for a weak or unsteady patient, ask another caregiver to follow him or her with a wheelchair. For a patient with a continuous IV infusion, obtain a portable IV pole and another caregiver to assist if needed. If the patient has a urinary drainage bag, make sure that it is carried below the level of the bladder and that there is no tension on the tubing. After confirming that the patient does not feel lightheaded, assist her to a standing position. If she's unstable or becomes dizzy, return her to a sitting position on the bed.
You feeling dizzy?
Otherwise, let her stand until she gains her balance. Encourage her to stand straight, holding her shoulders back and looking ahead, not at the floor. Stand on the patient's weaker side, if any, place one hand on the gait belt in front of her waist, and place the other hand under the belt in the back. Then take a few steps. If the patient becomes weak or dizzy, return her to the bed or a chair, whichever is closer. If necessary, obtain additional help. When ambulating in a hallway, position the patient between yourself and the wall. Encourage her to use the handrail with her stronger hand if possible, and to walk normally for the desired distance. During ambulation, walk in the same pattern as the patient, stepping on the left foot and right foot when she does. Observe her body alignment and balance while standing and walking.
There you go.
If the patient begins to fall, hold the gait belt firmly and step behind her. Stand with a broad base of support, extend one leg, and support her in a gentle slide to the floor as you lower your body with your back straight and your knees and hips bent. Call for help right away. To help a patient ambulate using a cane, apply and use a gait belt as shown earlier. Place the cane in the patient's stronger hand. Instruct him to move the cane forward 6 to 8 inches and to the outside of his stronger leg. Help the patient step forward with his weaker leg. The toe of his weaker foot should be even with the tip of the cane. Instruct the patient to put his weight on the cane and weaker leg and step forward with his stronger leg so that his stronger foot is next to his weaker foot. Walk in the same pattern as the patient, stepping forward on the right foot and then the left foot at the same time he does.
Good morning, Miss White.
To help a patient ambulate using a walker, apply and use a gait belt as shown earlier. Help her position herself within the frame of the walker.
We're going to grab your walker and put it in front of you in the center. Are you ready? When we go to start, place
If the walker doesn't have wheels, instruct the patient to move forward by lifting the walker and setting it down 6 to 8 inches forward.
Good. And again. Step.
If it has wheels, have her move it forward by rolling it. Help the patient take a step forward into the walker with her weaker leg, and then move her stronger leg forward. Walk in the same pattern as the patient, stepping forward on your right foot and then left foot at the same time she does. Encourage her to keep her chin up and look forward as she walks. No matter which device is used, Ambulate the patient the distance instructed by the charge nurse.
And let's pivot.
As part of your follow-up care, return the patient to her bed or chair, and if appropriate, remove the gait belt.
Backwards. Reach behind you for your chair. Okay.
Make sure that she is comfortable and can reach anything that she needs.
Is there anything else
Perform
we need
hand
to do right
hygiene and
now?
report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.